All right, we're live. Hi, Sean, Kevin, and Thea from RPHL, and we are here to announce Dr. Thea Blystone's channel today, RPM CCM. Fascinating stuff because it's like we were just talking about clinical services that pharmacists can provide. So I'm gonna kick it over to Kevin to ask Thea what's going on here.
Yeah, no, Thea and I have been close for a while. I call her my sister over the Rockies. Like Thea is always very real with things, a wonderful person in lots of ways. But the reason why her and I get to nerd out together is on RPM, CCM, TCM, BHI, all the things in between and the alphabet soup. We'll just call it remote pharmacy services for today. But Thea, what was the reason? Because you and I have some similar background components, but you went in and you really shifted over to something that I'm very interested in seeing the future of our profession gravitate toward, and that's remote pharmacy services. So why did you get into it? Like, how did you get into it, and where do you think it's going?
Well, I got into it because I've done all aspects of pharmacy, right? I've done long-term care, I've done retail floating, I've done retail big box, I've done retail independent, I've done remote medication therapy management from a company 10 years ago. And when I went to the hospital after all of that, I realized that dispensing wasn't where pharmacy is going. And the value that I've always felt is I want to help patients. I loved my interactions with the patients at the retail pharmacy counter, but I hated the metrics. I hated every piece of having to be a volume-based store and really just wanted to provide wellness and care for the patients. And I live in small town Northwestern Pennsylvania, and there is nothing here but pharmacies, banks, churches, and bars. That's what you get here in Northwestern Pennsylvania. So, when people are looking for care, they come to the pharmacy because there's not a lot of avenues. And to be able to deliver care for the patients without dispensing something was huge to me. So I took a little bit of all of my background and put it together and said, okay, what can I do that's going to be care? What can I do that's not dispensing? And what can I get paid for? And this is what I came up with. And the collaborations that I've been able to build with physicians and offer these services under the care management umbrella has been huge for the last 3.5 years. Really showing great results from the patient level as well as the physician's outcomes through their quality measures and different things as well. So yeah, it's been great.
That's awesome. So with that, like the fact that you always cared so much about like direct patient care and trying to find ways to impact them, and living in a remote rural area, which you and I share that kind of component, and Sean grew up that way too, is we can't reach patients always in an urban center and environment. And two, the patient sometimes can't get to us even if that's the case. And so being able to use remote patient monitoring is one of the elements you're talking about, and chronic care management, to do these things in a remote type of setting and a satellite type of setting can be so beneficial. Do you think that this, Thea, when you're having individuals come into your channel, kind of moving forward, and what they're kind of expecting overall, give me the idea of like how we're going to be interacting with patients, how we're going to be learning about these different care settings when I join your channel?
Well, throughout the channel, there'll be different modules that they can learn about kind of at their feed. It's not been updated yet or uploaded yet, but it's coming. And with that, it's going to be really allowing them to get all of the information. But it's not about the information that I have found so useful over the last 3.5 years of doing the work. It's the mentorship that goes in behind it, behind the scenes, because this career opportunity is so relevant to today's telehealth everything, and pharmacists are being pushed out of volume-based care in the big box stores and really having to decide what's lighting my fire about pharmacy and what has lit my fire about pharmacy to stay going to that retail job every day. And that's really where I find myself in the position of really that mentorship program is going to allow us to spend a year-long program. You get the content when you want it. I'm not going to drip it or anything that way. You'll get it, access to it when it's there. There'll be case studies and outlines and what you can learn along the way and where to start and where to go. Is including up to and including those collaborative practice agreements, collaborative business agreements. That collaboration with the physician is going to be its own like module in there to really be able to see that and grow that throughout the year as well. With mentorship, the applicable part of that is going to be that you're going to have to do the work. They're going to have to do the work of wanting to do this. But to be able to have my experience background with them throughout the process, they're always going to have a resource to answer their questions and get the results that they're looking for.
Yeah, I love that. Sean and I talked before kind of about, it's funny, whenever I point guys, like I literally think I'm pointing at Sean and it reverses it on me so that I'm pointing off into space is not me being a cadet. But regardless, when Sean and I were talking about a year-long program, one thing that I was really focused on is exactly what Thea was just talking about. Like she has all the details. Like she knows the CMS guidelines, she knows outside billable guidelines, private insurers, limitations per state, all those individual like components that are necessary for you to be successful in the space. But it goes so much deeper than that. Like, and the ability for you to navigate an ever-changing environment really necessitates that year-long commitment to become an expert in it. Because Thea and I, when we were starting off initially, she was like, Kevin, here's a couple Excel spreadsheets. Like you can be able to gather your data, put it all in one place, simplify it. But for you to use this, like you have to have the relationships with the patients. You have to have the relationships with the providers. You have to make sure that all of your documentation is solid in the background. So you're saving on your workflow and the time commitment necessary. So you're not losing money on this effort. And I think that's one thing, Thea, that you've kind of educated me over the year or so that we've been together is just it seems simple just reading a CMS pamphlet like, oh great, I can do this. It's not. Like there's so many different nuances to it. So tell me, with all those nuances like that are kind of in that space, what's the reason that you wanted to add all of these kind of details and this type of package into RPH Ally? Like why did you want to bring it here?
Yeah. I think right now is time to move as pharmacists. We're on the move for what our career can look like as we look at what telehealth has done for our communities throughout the last 3 years. It's really been up to new environments, and that oceans of different opportunities are out there. And when we look at who else is coming to the table of care management, it's your nurses, it's your MAs, it's your LPNs, and they're doing these programs, and that's great. I think there's plenty of patients to see, right? Like, but I feel like when you look at what a pharmacist does at their retail pharmacy counter and the care that's given and delivered there, I don't believe the healthcare system at large understands the care and opportunities that we as pharmacists offer in our communities. Yes, I just read the statistic at APHA, just put out their news brief today was we vaccinated 270 million people as pharmacists, and that related to less than prevented 1 million deaths from the disease or from the pandemic. And so 270 million vaccines pharmacy was able to do. And why aren't we at the table? Why aren't we at the table to be able to watch this data and really see if the medications are working? Why aren't we at the table when Mrs. Smith comes to the pharmacy every month and asks about drug adherence? Those are all quality measures that we don't, as pharmacists, we were never taught about quality measures in pharmacy school. At least I wasn't. And what that looks like today and how to make an impact on those quality measures. And I think that when we look at what pharmacists, like how many pharmacies just last month did something around breast cancer awareness because it was October, right? Like how many pharmacists? Well, that's a quality measure that the physician offices get benefit from. Like, do they know we do that? The silos need to be broken, and we have the opportunity to really hone in on that. When you look at data and you see the remote patient monitoring devices coming back in with all this data, and like I think for the one program up to 14,000 data alerts for this year so far, just me. Like that's my baby. Wow. And so a doctor can't handle that. Like they're not going to be able to add that on to their day. And when you look at the other programs and how other programs are running with MAs and nurses, who are they triaging all of that to? When did an MA go to pharmacy school or have pharmacology? Like, do they know the limitations of the medications? Do they understand where the limitations of the medications are to be able to triage and ask the right questions? I beg to differ. Like, I don't feel like they're the best qualified people for care management at that level. I think pharmacists have a really great opportunity ahead of us to be at the table for care management throughout population health departments in every community hospital, to public health, to departments of health. Like there is so much opportunity for pharmacists to look beyond dispensing and see the clinical value that we add to Mrs. Smith every month. She comes into my pharmacy and talks to me. Like that conversation is where my job as a remote pharmacy service delivery person is. Like, if you can have a job or you can have the conversation with Mrs. Smith at your pharmacy counter, you could do what I do. And it's that easy. And people are like, what degree do I need? What more do I need? Do I need a residency? Do I need this? I'm like, nope. I'm just your standard girl, country girl that figured it out. Like, I don't know, it's one of those things that's really, really humbling for me to be able to share this now with the world, because I've put blood, sweat, and tears for the last 3.5 years doing this, creating the practice that I have, but also creating it in a health system so I can navigate both in entrepreneur and entrepreneur, if you will, looking at how to, if you want to go into a business for yourself versus do you want to stay where you are and do a clinic live, like go into a clinic and do these services. I've done both, so I can help facilitate that as well throughout the year. It's not location dependent, I suppose. Not pharmacy, awesome. Not, health system. It could be a small business. It could be from the beaches of Bora Bora, if you will.
Okay, so let's clarify that, Thea. So your target pharmacist that you want to teach this to is not just in a pharmacy, right?
They can be any practice setting.
Any practice. That's perfect. Any practice setting. Love it. No, that was my only question. Perfect. I'm sold.
Yeah. No, I love the RPH ally piece that you mentioned, Thea, just with really one, like you have to be able to broaden like how many folks you can reach, because this topic is evolving so quickly and pharmacists need to get involved now. But two, the other thing that you really hit on that I love is the silo dropping. Like not only within our profession, like we need to have folks with functional medicine skills, herbalism skills, pediatric skills, getting into remote patient monitoring. Like RPM needs those skilled individuals and vice versa, right? And the exact same thing across professions. So how can we educate, as you mentioned, with breast cancer awareness, looking at metrics and being able to align? Like that's one thing that we've struggled with for way too long. We're aligning with dispensing models. We're not aligning with clinical models, with medical billing models, with the models that are necessary for us to be able to integrate into what's coming up in quote unquote value-based care, what's coming up in even fee-for-service models that are allowing us to now become a member of the team. And I think that you trying to look at that for the pharmacy world to get us all kind of on the same page when it comes to integrating there is just so helpful. Any like big parting words from you, Thea, on like why you think more pharmacists should think about learning more on chronic care management, RPM, transitional care management, everything under the care management umbrella?
Yeah, I think the biggest takeaway for me when I started looking at it was I don't need more. I don't need more education. I don't need more practice settings. I've done everything but teach and law, I think, and maybe research. And I'm like, I don't want to do any of those. So like, what do you want to do? Like, is care why you got into pharmacy? If it is, this is an avenue to look at it. And without having to dispense, without having to worry about every profit ROI thing under the sun for a retail pharmacy, it really just allows you to get paid for your time and get paid lucratively for your time for offering care that we know how to do. We know how to meet the patients where they are and take them down their healthcare journey with them. We do that month after month after month as a retail pharmacist and even as a health system pharmacist as well. I mean, we really, if you got into pharmacy to take care of patients without touching them like I didn't want to touch you. I just wanted to help you. And if that's true, then this program is a definite way out of what we know as dispensing pharmacy today and where really the future of pharmacy is going.
Sean, off to you, buddy.
Yeah, awesome stuff, Thea. We're really excited for this channel. So if you're interested in this or anything else related to pharmacy, rphli.com, get plugged in, check out all of Thea's stuff that she'll be, telling you about here in the near future. So thanks again, Thea.
Yeah, thank you guys. See everyone soon.
All right, talk soon.
Bye-bye.